Welcome to Sinclair Educational Grand Rounds. I'm Dr. Zahida Chaudhary.
And I am James Ellermeyer, a behavioral health therapist here at Sinclair, and it's a pleasure to be with you today, Dr. Chaudhary.
Thank you. The purpose of these Grand Rounds are to educate the community regarding the illnesses and also the importance of integration of healthy lifestyle, which is very effective for the chronic diseases or any disease which we have. Today's topic is regulation of the blood sugar level with special focus on diabetes. So in American, it's an epidemic actually. 26 million with diabetes and 79 million with pre-diabetic. It means that diabetes affects almost 26 million Americans, which is 8.3%. 1/4 of whom don't know they have it. About 1.9 million new cases of diabetes are diagnosed in people ages 20 or older. So in the past, the diabetes, which is 2, was a disease of adulthood. And now it is becoming more prevalent in younger adults and even the children. So blood sugar regulation is very important. And what is the law of the body is that the body must maintain certain level of sugars in the blood, and that is about 100 fasting. Normal blood fasting glucose is 100, and when you exceed that 125, you're pre-diabetic. When you become 126, it is diabetes. In this slide, if you see that this is your blood vessels, and then you have glucose in the blood. In one of that, you see there are a lot of those small particles, which are white particles. These are too much blood glucose in your blood vessels. But how sugar controls work? Now, if you see the organs, liver is on your right side. It's around 2 to 3 pounds. And then we have a tiny organ, which is pancreas. And in this slide, you can see it very clearly. The liver and the pancreas have mutual relationship. They coordinate to control the blood sugar levels. But the liver is the most ignored piece of puzzle. In this small presentation, we will not be able to describe the whole lot about the liver issues, although we will focus on more of the insulin. But maybe in future we can talk a little bit more about what is the role of liver in regulation of all these blood sugar. And so liver controls blood sugar levels when we are not eating, and pancreas controls the blood sugar levels when we are eating, and they go back and forth. If you see in this slide, you have pancreas make hormone called insulin. What's the role of the insulin is take sugar out of the blood, and then it sends it into the cells. So the level of the sugar in your blood decreases and goes into the cells. And in the liver, it stores as glycogen. So liver takes this glycogen and converts this into sugar when needed, and puts this into the blood and keeps it normal around 100. So this is normal, what is going on in the body. And if you see what happens when you have a good amount of the insulin, 3 things happens. Energy, our cells use sugar as a form of energy during exercise and even otherwise. And it is stored in the liver muscle as a glycogen. And when it is too much of a glucose, when it's not used, it is stored as a fat and can be used later on when it is needed. So the oxidation of the foodstuff is like a spark which liberates energy. When we eat, eventually it's broken down into sugar, and we use that sugar in as ATP, which is energy. It's the same way as we are eating carbohydrates, protein, fats, and you say it's $100 bills, and then it has to be broken down into your cells to give you a smaller quarter so that your body and cells can use it as a source of energy. Even food which are not sugar are eventually converted to sugar, so your body can use it as a source of energy. So sugar, which is glucose, is the fuel for the nourishment for our cells. and it's very important that we regulate it properly. So there are different kinds of diabetes, although type 1, type 2, and also gestational during pregnancy, but we'll focus on type 2 diabetes today. So type 2 diabetes is usually, in type 1, if you see, you're not producing sufficient insulin in your body. But in type 2, insulin is there, but your cell is resistant. If you see this slide in which there are receptors here, and the insulin become very resistant, it's not able to send the glucose into the cells. And that's the reason I would say that your cells are starving, because they need that glucose to work and give you energy. This is a beautiful slide in which says in type 2 diabetes, stomach converts food to glucose, and the glucose enters into the bloodstream. Pancreas produces sufficient amount of insulin, but it is resistant to effective use, and then glucose unable to enter the body effectively, and the glucose level increases. And if you see this is very beautiful. It explains very well. So insulin resistance and health problems. Insulin resistance is associated with many health problems that includes fatigue, brain fogginess, high blood sugar, intestinal bloating, sleepiness, weight gain, and increased blood triglyceride level, which are bad, actually cholesterol. And it also increases the blood pressure and depression. So there are a lot of things which are caused by problem with your insulin resistance in type 2 diabetes patients. And then you have cardiometabolic risk factor. Some are non-modifiable risk factor, like age. You can't change the age, race, gender, family history. You can modify them, but you can modify many other factors, which are being overweight. You can control your weight. Being abnormal lipid metabolism, you can control by good exercises and good food. Inflammation, hypertension, smoking, physical activity, right? These all things are modifiable, and you can skip your unhealthy diet. They say that 2 in 3 people with diabetes die of heart or stroke. Diabetes is #1 cause of adult blindness, and is also more than 60% of non-traumatic limb amputation because of high sugar and its complication, and you have neuropathy. So how we manage this? And that is a question. What we do here at Seclair is we are making aware of the community, the effect of diet and nutrition, and this is a big part. We are educating the community about what is the role of diet, and what's the role of exercise, and what's the role of meditation for the stress reduction, and how it is so effective for your health. That is including diabetes. So the major component, even if you see for the conventional medicine, diabetes are still, if you go on the top, it's diet and exercise. Then it comes to oral hypoglycemic agents, which is very effective if your sugar is out of control. And the last resort for type 2 is the insulin therapy.
Dr. Chaudhary, what would be, if someone would get their glucose level checked, what would a normal level be for an individual?
That is what I explained in the first slide, was that 100 fasting is normal, less than 100. When you start exceeding 100, especially when you are at 125, it is pre-diabetic, and nowadays 126, that you're labeled as diabetes.
I believe that if you asked most people and gave them diabetes and asked them to give the first 2 words that came to their mind, one would be insulin and the other one would be pancreas. I don't know how many people would say liver, Dr. Chaudhary. Exactly,
and this is what I'm going to do maybe in the next presentation. Whenever we have the grand rounds, maybe we can do a little more detail of what is the role of the liver. Because see, one thing which we have to understand is that one is a disease. Now I have, for example, I have diabetes, type 2 diabetes. So these are the lifestyle changes, these are the medication, this is how we are going to treat it. But then comes to the point of why you have diabetes. Although many times it runs in the family, like type 2, it does have a genetic component to it. and environmental factors. But you have a lot of other factors. Stresses can really ruin your hormonal systems and hormonal balance. Hypothalamic pituitary adrenal axis can be affected, in which you have ton of cortisol which is produced. So these all things are really changing all the metabolism of your body. So there are a lot of things which are causing resistance to insulin. So focus here is one, you have that, how we can manage that, right? So there are tons of underlying factors which we have to change. It is not just that, take a pill and you'll be fine. And that is important to understand, that there are a lot of other things which are going on in our life which are very important to deal with. So lifestyle changes such as losing weight, eating healthy, and increasing the physical activity can dramatically reduce the progression of type 2 diabetes, and it is scientifically proven. It also minimizes the risk of high blood pressure, high cholesterol, and it has tremendous impact on the people with diabetes, the lifestyle modification changes. Although I believe in that when you need medication, you take medication along with that. It is not that you skip the medication altogether when you have a severe diabetes, right? It's important to take your medication along with this. And slowly, gradually, what happens is then you can decrease your dose depending upon what is the level of your sugar and how you are taking care of it with lifestyle modification. And once you are there, then slowly, gradually, I have seen actually many people who have quit taking the medication. Okay? But
wonderful.
It requires dedication.
Indeed it does. And quite often, what we deal with here at Sinclair is people resistant to change. And what we ask people to do through mindfulness, through the DBT skills, is to be able to understand that they have a choice in their life.
Right.
There's a big difference between saying I have to start eating more vegetables rather than I choose to eat more vegetables. Right. I have to exercise. Oh, I have to go to the gym.
Like a punishment.
Yes. You're punishing yourself. You're giving yourself orders. Well, if you say I have to go to the gym, what's your workout going to be like at the gym? Right. And however, just the difference in the perspective, I choose to go to the gym. Everything in your life is a choice, Dr. Chaudhary. Right, right. And then enjoy what you do. It is not like, oh, another thing to do, right? Oh my God, another thing to do. I have to not go to the gym. I have to do this. And sometimes there are a lot of other activities, like if you do not want to go to the gym per gym, we can do activities like sports, which are enjoyable, which we like to do, right? So we can organize our activities according to what we like and enjoy them. Food, what we like and enjoy them. And the same way is, then comes the stress reduction, which is a little more difficult for people. Meditation, right? Focus, mindful living. That is a little difficult for the people who don't have those awareness of these kind of concepts. And they dramatically affect your body, and they dramatically decrease your blood sugar level, because blood sugar is actually, the stress is a very, very important component of raising your blood sugar level and having the insulin resistance. What you and your husband, Dr. Chaudhary, have done is allow people to, we present possibilities, many possibilities. Right. So our body is not designed to take like 149 pounds of sugar per year, right? And it is average American is consuming 149 pounds of sugar per year. So our body is not designed to that. Eating baby food is loaded with sugar, right? And then you have juices, sodas, very high in sugar. So when we are talking about diet and nutrition, the aim should be important thing, how to ensure the weight control, how we can provide our body with the nutritional requirements, and allow good glycemic control, right? So that our sugar level is in control, and correct our lipid abnormalities, which is very risky for the cardiovascular events. But there is another thing when we talk about the glycemic control is glycemic index. Now, glycemic index is one of the important, actually, important thing to understand,
What is glycemic index? It's a measure of how quickly blood glucose level rise after eating a particular food. But it has much to do because people talk about the glycemic index, but different food have different glycemic index. Some are very high in the glycemic index and some are low. And for insulin resistant, we require to have the food which has less glycemic index. But this is a huge topic itself, because then we have to see which food is good in glycemic index, at the same time how much insulin is released in response to that food. But if we are eating a food which has a good low glycemic index, okay, and we are eating in tons, so then you should see what is the load of that food, right? So the load is very important. So a portion of the food should be washed, regardless of what glycemic index the food has. The portion is very important for your weight control also, and for the regulation of your blood sugar also. So the research, if you see, found that the people burn more calories on the low glycemic index food, provided that they're using a portion, which is, so although we know that the vegetables we have that window in which we can eat more vegetables, and it will be very effective as compared to if we start eating meat a lot. So vegetables still give us actually very good control, even if we are eating in bulk. But then again, in the bulk does not mean the tons, right? Then it becomes like a portion again, and what is the load against which we are releasing glucose, and then we are making insulin. So low glycemic index diet, minimally processed grains, vegetables, healthy fats, lean proteins, carbohydrates, but stay away from refined carbohydrates like potatoes and other starchy vegetables, because they have a high glycemic index. And again, I said there is some limitation to the glycemic index too, against how much we are eating and how much insulin is released in accordance to what we eat. So we eat a balanced diet. You want to talk about the balanced diet?
Well, at Sinclair, should you have further interest in these educational topics and your overall wellness, every Wednesday from 11:30 until 1 p.m., we have an educational hour and a half where different things are provided, and a lot of it is centers around nutrition and a balanced diet. Disease, as Dr. Chaudhary well knows, is when things become out of balance.
Right.
And when it's just the way our diet. What do we want to look at? We want to look at proper hydration. We want to look at the proper amount of fruits and vegetables and protein in our diet. One of the things that I've been doing lately, Dr. Chaudhary, and I should have you with me when I do this, is I've been looking at labels on everything that I buy.
Oh, great.
It's a little scary.
Yeah. Yeah.
The things that are in there. And my own thoughts are that a balanced type of lifestyle, and if you're unsure about this, one of the most courageous things to do is to ask for help. And here at Sinclair, we have 2 nutritional therapists associated with the practice that have educated me more than I've ever learned in my life.
Good. So in conclusion, it's the lifestyle modification. For every disease which we have, no matter what we have, changes the way we live, can change the way we feel. While there is no cure for many things, but there are a lot of things can be prevented actually. And healthy lifestyle, what it is? Healthy food. What else? Meditation, which is a big part of Sinclair. Meditation means how you cope with your stresses, which we were talking about, the DBT sessions, how you cope with the stresses. And once you know how to cope with the stresses, you can really make a lot of changes in your own lifestyle and in your own body. Exercise, lifestyle changes, eating well, spirituality. So walk more and enjoy your life.
The speed bumps in life are going to keep on coming. The potholes are still going to be out there. What the DBT skills do is allow you to cope with these things that occur in your life in a healthy way.
Right.
And To continue this conversation, please like us on Facebook, plus on Google Plus, or follow us on Twitter under Seclair Life. And keep an eye on any of these for our next live recordings Monday around noon to ask your own questions. You can also find this or other Grand Rounds on youtube.com/Seclair Video, and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. And thank you so much for allowing me to be with you today, Dr. Chaudhary.
Thank you.
And allow yourself to be good to yourself.
Yeah, and thank you, Mayor. Thank you, Mike. Thanks.